So thank you very much for being here today. Maybe let's start with a brief introduction. Tell the audience who you are and what your organization is doing overall. Maybe Tas from your side.
Sure. Morning, everyone. It's great to be here. This is my first time at the Bayer Foundation event, and I must first of all congratulate amazing players who have been demonstrating their work at different aspects of human lives. So many congratulations. That's inspiring, to be honest, and makes us do better whatever we are doing. I'm Taslim Arif Sayed. I am neuroscientist by training. I lead an organization in India which is called CCAMP, which is working to foster deep science-based innovations and make impactful changes in society, be it in health, agri, or environment. We strongly believe that science has a key role to play in building solutions in difficult situations and difficult geographies to make a huge difference, and that's what we have been doing for the last 15 years. Great to be here. Thank you.
My name is Mark Horshowski, and I'm from Seattle, and the organization that I co-founded and lead is called Moving Worlds. And maybe to see a little bit of who's in the crowd here, can I get all the social innovators, social entrepreneurs to raise your hands very, very quickly? So not quite half, but a good show. And maybe for the sake of an experiment here to help set the stage for the work that we do at Moving Worlds, which is about capacity building. Maybe I can even ask for a little bit of interaction, so don't be too shy here. I'm just curious, like, for some of you who have just received an award, others maybe in the previous years, what is the thing that is currently keeping you up at night? As you think about scaling your organization, scaling your impact, scaling your revenue, what is the thing that is holding you back, keeping you up? Just be brave this morning, throw it out. Okay, working capital, no surprise. Who agrees with working capital? Yeah, show me an entrepreneur, I'll show you somebody looking for money. Yeah, what else?
That's true.
Human capital, yep. Anybody else? Just throw it out, yeah? Human capital, partnerships, yeah? Sales, communications. I'm sorry? Politics, yeah, okay. Now, what about the non-entrepreneurs in the room? Can you raise your hand for a second? The non-social innovators. You are every bit as impressive as our social innovators. But now, as you hear these words, right? Okay, human capital support, marketing support, sales support, team building support. I want you to think if you can visualize somebody in your professional network that could probably lend a helping hand, that maybe would have expertise or guidance. Can you show of hands, who was able to really quickly visually think of somebody that they know that could be helpful to an entrepreneur? Right? So almost the same number of hands, right? And so that's what we do at Moving Worlds, is we globally around the world work with social innovators, help them understand their biggest needs with the scale-up assessment or even just self-reported, and then make that expertise known to a global network of professionals. Those global professionals often come sponsored by some of our corporate partners who then volunteer those skills. And I'll show just a quick screenshot of what the platform looks like for social entrepreneurs. So not only can you connect with expertise, but you can find corporate partners. You can connect into other peers and innovators to help connect with people that have gone through the same journey that you have gone through. And I think the other part of this that comes back to the Moving Worlds mission of really trying to make a dent in the global economy is to also prepare the professionals to be supportive to social entrepreneurs, not only as volunteers, but as they return to their companies, to bring these social innovators into their supply chains, into their value chains to make companies more responsible as well.
Thank you, Mark. Celeste?
Yes, hi everybody, and thank you for inviting me to this panel. It's an honor to sit along all of the other speakers. So I'm Celeste. I lead the operations at the Missing Billion Initiative. We work to improve health access and outcomes for persons with disabilities globally. So just for a bit of context of our work, 16% of the population lives with a disability. That's almost 1.3 billion people, so that's not a small number, and they systematically are excluded from health systems. They face greater challenges and barriers when accessing health, and this leads to worse health outcomes in all areas of health, so maternal health, non-communicable diseases, communicable diseases, infectious diseases, and overall this leads to a 10 to 20 year life expectancy gap when you compare to people without disabilities. So, and this is largely due because of health systems are not built with people with disabilities in mind. They're not accessible. So health facilities are not accessible. Healthcare workers are not trained on disability and do not know how to engage, communicate, treat patients with disabilities. And so at the Missing Billion Initiative, we facilitate system change to really build inclusive health systems. And we do that working in three areas. First of all, we provide data, so to inform funders and implementers working in health to inform them on how their work affects or doesn't affect persons with disabilities. We develop and we deploy tools to help ministries of health understand and identify and implement concrete actions at their country level. And we also globally build community and a movement centering persons with disabilities to really build an inclusive health movement. So I'll stop here.
Thank you, Celis. Maybe Maddie?
Sure. Good morning, everyone. It's an absolute pleasure to be here. So much inspiration on day one. My name is Maddie Bajoria. I'm the Partnerships Director at AVPN. I know some people here in this room, but for those of you who I don't know, AVPN is the world's largest community of social investors. We have more than 600 members across 33 markets with a specific focus on Asia Pacific. Now, the core mission of AVPN is to increase the flow of capital to the social sector by connecting and empowering key actors who are working to achieve the SDGs across the region. So when we say capital, we actually work across the continuum of capital. So our members include everyone from philanthropic foundations, impact funds, blended finance actors. So we're a very inclusive network. So what we do is we play the role of an ecosystem builder and we catalyze the movement towards a more strategic, collaborative, and outcome-focused approach to social investing in Asia so that resources are deployed as effectively and as efficiently as possible. So as part of our strategy for the next decade, we have adopted 4 thematic pillars to effectively mobilize capital towards these critical agendas. So these include climate, health, gender, and youth livelihoods. So our action-oriented approach has led us to create dedicated platforms for each of these pillars, which are building the funding ecosystem for these agendas, exploring intersections, and ensuring that they receive the appropriate attention that they deserve. So it's with this context, in support of AVPN's efforts in the nexus of climate and health, that Bayer Foundation collaborated with us last year to launch the Climate and Health Lighthouse Hub, at COP28. And this hub actually envisions building the ecosystem infrastructure for Asian social investors of all types to find collaborative pathways to develop their intersectional climate and health agendas. This initiative owns that all these agendas are locally owned, locally led, and basically increase the likelihood of successful deployment of capital, which is at the heart of everything we do, and I'll be talking more about this later on, but thank you, lovely to be here.
Thank you, Maddie. Yeah, and it's really nice to see that the collaboration we did last year, the Pathfinder Initiative launched in COP28, has grown into this Lighthouse Hub, where CCAMP is also one of the key partners. Maybe Taz, from your side, what is the role of the CCAMP in this whole Lighthouse Initiative? Could you maybe describe?
No, thanks. Thanks, Pong. So broadly, we all know that, if you cite World Health Organization, climate threat is one of the biggest threat to human health as well, without any doubt. It is interlinked with the issues that we are all seeing around us, including the the air we breathe, the calamities which are around us, which are actually leading to much more grave conditions on the ground in geographies which are vulnerable to that. And the aspect is that how do we understand where that intersection happens and see what we can do in that. The projections which are there are actually very alarming. The way the climate change is impacting health. If I just do a very quick citing, the components how vector-borne disease are actually going to evolve or become much more prevalent in areas which are not known to have vector-borne diseases. The diseases like malaria, chikungunya, dengue are actually projected to be much higher in conditions where they are already there and going to be now present where they are not going to be there. I don't know if you've heard of it, but after COVID, there is an incidences of TB in the US clearly cited. These are clear examples of how climate is actually changing issues across. Also, there are much more bigger pictures of neglected diseases which are coming up. What I'm trying to say now, and I will do very quickly, this is clearly an indication of climate is slowly but very specifically impacting our health issues. And the global south that we are talking about today, it's much more vulnerable, which is going to impact the larger world as well. But there is a hope. The hope is that there have been such situations before us. The example like what we know about, I don't know how many of you know about a disease called polio. Almost 100 years back, polio was there across the world. Today, it is endemic only to 2 countries. And that is why, because science actually has played a role in understanding the emergence and the spread of polio and made interventions in those geographies to do that. What we are hoping to do at CCAMP, which is an Indian government backed with the vision of going to across South Asia and beyond, is to build and foster solutions which can do early detection and surveillance of such prevalence and emergence of those things, build solutions which can target one of the biggest issue in global health called AMR, build devices which can bring air and water sanitization, and more importantly, build climate-friendly green technologies. So there is a larger issue. What I meant to say is that in global south, we need to build local solutions, and that's what we are trying to do. Solutions which are much more related to the local issues in the health systems, try to spot them early, try to stop them early, spot them, stop them early, make interventions so that you can actually have a much better control. Identify vulnerable areas, play science-based, customized solution role, and based on that evidence that you generate in specific geographies, take that model and go to other geographies which have proximity of such limitation settings. We are coming, the idea of what I've said is not new. We have been around for 15 years, and we have now demonstrated with specific local innovations. Actually, you can make a difference. I'm going to take 1 minute, Pong, if you don't mind, very quickly, to cite how remarkable, if local innovations are boosted, it can make a difference. Through one innovation, which is now we have built over the last 7 years for what you call it as a neonatal CPAP device. I do not know how many of you know. It's a simple respiratory device for within a month of life. When premature babies happen, they do not have strong lungs to breathe properly. So you have to give what you call it as a support till their lungs actually get strong enough to do that. The CPAP device has been built over decades, but still neonatal mortality is hugely caused because of this what you call acute respiratory distress syndrome, which actually happens to that in countries like India, in many other countries. The locally built device, which we have now built in and deployed in one state, single device, Pong, I wanted to say, single device we have been able to build, which is better effective in that situation. We have been able to bring down the neonatal mortality by 30%. And that is not small. They have not challenged the global best. They have just built a local, better, effective device. And that is the power of building local innovations. That is the power of supporting local innovations and local innovators, which can actually are solving the problem after understanding the local problem. building the evidence and taking that evidence to the scale up in the larger specificity areas. And that's what CCAM aims to do with collaborators like IHF and Monash, along with AVPN as well. So that's, I'm sorry I went long, but I wanted to give a gist of that. Thank you.
Thank you,
so much.
thank you, Tess. And coming back, Maddie, now we have partners like CCAMP bringing the scientific evidence and also local rooted innovation. Who else are the key partners, and what is the next step for this Lighthouse initiative?
Yeah, absolutely. So I think Dr. Taslim did an incredible job of laying out what the nature of the problem is. What is the dire state of health impacts of climate change in a very susceptible region like Asia? But what is very notable is that there is also a significant gap in meeting the climate adaptation financing needs for human health. In APAC, this gap exceeds $3 billion, or more than 6 times the existing level of funding. So it's obvious that there is a need to unlock additional forms of catalytic capital, including impact investing and blended finance, that can enable the sustainability of healthcare systems. So with this backdrop, we designed this health and climate lighthouse initiative for Asia. And of course, CCAMP is one of our very valued technical partners with a long history of solutions, building local solutions in India. Together with them, we have the Monash University that has been doing really important research at this intersection in Asia, not just Asia, in the global south for a number of years. And we have the India Health Fund, which is a locally driven, it's a large fund that's endowed by Tata Trust. So a very good example of domestic philanthropy in Asia that's working towards addressing some of these important challenges. So with this consortium, what we have done is we have designed the Lighthouse Hub to be a sort of backbone infrastructure for Asia. And it essentially has 4 key components. So the first component, and this is essentially envisions what it is that we're trying to do over the next few years. We want to generate evidence and enable information exchange. So essentially, we want to build the knowledge base and a thought leadership repository, as well as incubate projects on the impacts of climate and health. It's an emerging area. Everyone is trying to figure it out. So the potential focus for prioritization will be determined based on local contexts and needs, but it can cover anything from air, water, and food quality and related health impacts. It can include infectious diseases, workforce development and capacity, mental health and well-being, and of course, sustainable healthcare systems. Secondly, we are hoping to translate insights into actionable interventions. So we want to create a sustainable and bankable pool of projects and solutions that can be scaled by governments, by multilaterals, and most importantly, attract private investments into the climate and health sector. Thirdly, we want to build a community of practice. So we'll do this in a twofold manner. First, we want to build a community of practice for social investors who are interested in this intersection. And we want to convene them every quarter and curate engagement depending on their priority areas of focus. So really meet them where they're at. Alongside the funders, we also offer a neutral platform through this Lighthouse Hub to convene practitioners and policymakers to share knowledge products and inform policy on the thematic areas of focus. And fourth, we want to mobilize capital. We don't just want to connect and engage, we actually want to get money out the door. So to begin with, we have created a collaborative pool fund, which will be run over the next 3 years and deploy $10 million. And then this will be both philanthropic and impact investment capital, looking specifically at social innovations that are solving for this challenge. Over the next 10 years, we hope to be unlocking $200 million at this intersection. And in this way, Bayer Foundation's seed investment into this initiative will have 1,000 times multiplier effect if you look at it over a 10-year time frame. So very excited for this initiative. And we as AVPN are the partner that's providing sort of the backbone secretariat for this hub and playing the role of convener specifically for private sector investors and other social investors.
Thank you, Maddie. So if you also have an interest, invest into the climate and housing Asia, you know who to find during the coffee break. And then, Mark, I would like to get to you because the Transform Support Hub that you mentioned, to our knowledge, is one of the most transparent and digitalized platform that makes all the non-financial support to social entrepreneurs available and transparent. So could you maybe give us some examples of the latest initiative on the climate and health space, how you help the social entrepreneurs in this regard?
Yeah, would love to. And maybe even before doing that, going off note a little bit here, but Dr. Said, as you were talking, I almost got emotional a little bit in the story that you told. We had our first baby this year, and just the thought of not having access to that support. And I think that's what we all see, right? We all see these solutions that need to scale, right? And then Maddie, if I can build on the point that you said, there's a massive funding gap, right? You mentioned a 6x funding gap, and we all know that there are major improvements to try and get funding there. But what we find time and time again is that human capital is much less risk averse than financial capital. Humans will go to provide support where money won't go. And that's really what we're trying to do at Moving Worlds, is help mobilize human capital to provide gaps where there are funding gaps, right? Yesterday we heard 2,000 enterprises, right, are applying for the Women Empowerment Fund. We can't fund them all, right? But what we can still do is mobilize other forms of support. And via the Transform Support Hub on the Moving Worlds platform, we've supported thousands of entrepreneurs in across over 140 countries. But we know that if you can marry finance and capacity building together, right, the outcomes are multipliers, right? And so we're really excited to, this is a pre-announcement, to announce an announcement that will happen in October, where we will be partnering with the Bayer Foundation, which will be releasing a new fund around the term of healthy people, healthy climate. So looking for innovations at the intersection of health and climate. It'll be an open call for funding. For entrepreneurs that need help applying, they can access support via the Transform Support Hub, right? To polish their financials, to improve their presentation, to get guidance on their pitches and their content. Then there's that waiting period, right? Entrepreneurs, I know you've applied for more than just this one award. That waiting period where you've done all that work and you've submitted that application and then you don't hear anything for a long time. I know you've also probably heard lots of rejections. Rejections usually sound like, sorry, we're too busy to give you feedback, but try again next year. So we're changing the approach around that as well. We're saying in that waiting period, including with some of the expertise from this room, we'll be hosting capacity building workshops. So just applying will mean that you will get value from learning as well as access to our pro bono network. And then once awards are given, for all the organizations that are not chosen, we'll be getting specific feedback from judges so we can come back to you to say, if you can improve your financials, right, or your marketing plan, or your operations, or your human resources strategy, you'll have a better chance of getting funding in the future in order to keep scaling that solution. So if anybody wants to follow along, we just have a brief information page here. You can scan the code. I'll be here all day. You can find me afterwards. But we will be formally announcing this in October and looking for support, both in case anybody wants to provide additional funding to entrepreneurs. Please talk to Pong about that. But if you're also interested on the non-financial side, lending expertise or other, I'd love to talk to you as well.
Thank you, Mark. And we already have innovative solutions here with us. So Celeste, we know that the climate impact on people, especially vulnerable group, is much more dramatic than to the regular population. And Missing Billion Initiative has provided such an innovative solution that community health workers can address this challenge to the disabled people. Could you maybe give us some examples, concrete examples that you're driving in this health climate space?
Sure. Yes. So I think I won't, come back on the fact that health inequities are exacerbated by climate change effects. I think this was already covered very well by Dr. Taslim. So I can talk a little bit about the project that we're doing with the Bayer Foundation that was kicked off actually a month ago, and that aims to provide community health workers with the tools to better treat, identify, and refer persons with disabilities in Kenya, in a county called Migori. So this is a pilot project And the reason why we focus on community health workers, I think the opportunity is so great to actually improve health access for persons with disability. First of all, because of the counseling and the connection to quality care that they can provide by making health information accessible and making persons with disability aware of what health services are available. And this is something that I know for probably most of us here, it sounds maybe unbelievable, but for persons with disabilities, especially with intellectual disabilities or hearing impairments, they often just do not know where to get health services in their where they live. And so community health workers are really the first line of support in understanding what healthcare the people need and where they can get it. And just to add to that also, it's about building trust between persons with disabilities and a healthcare system that has often mistreated persons with disability and only seen them through their disability, even if they come for a health problem that is completely unrelated to their disability. And I don't know, they need sexual and reproductive health services, but healthcare workers just do not know how to communicate with them, engage with them. And so community health workers can really be the link between the people who are excluded with healthcare services. The second reason why we focus on community health is because the workers can really help with screening and case finding because they're the closest to the communities. They also know what the climate risks and the health risks are in their area and what the health conditions can, infectious diseases, the post-traumatic disorders after a huge flood or a drought or displacement that might come out of that. They understand this very deeply, and they're best placed to understand, also what the persons with disabilities in their community who is not getting support, who needs it, and where to refer them. And then lastly, they're really making healthcare more accessible because they're meeting people where they're at. And for persons with disabilities, that is often at home. If they cannot, are not able to access health facilities. And after climate events such as the huge floods that Kenya is has been experiencing in the last weeks, they know where persons with disabilities are displaced if they are, and really if just meeting there where they at, which often persons with disability will be isolated also from their community because of stigma. So there is this need. We started working with about 400 community health workers last month, asking them, we're starting the project just asking them what they think the needs are, and also asking persons with disabilities, and building kind of a toolkit with a blended training, so both in person and digital, and giving them the basic resources on guideline for communications, information on the different impairment types, just to also know how to identify a person with disability. And the goal is really to have the healthcare workers mainstream a disability lens in their work, not so much to add another task for them to do, but to really be able to see people with disabilities and treat them as they deserve it with dignity. Yeah.
Thank you, Celeste. Yeah, I see we're a little bit short in time. I would like to leave the opportunity to the audience. If you have any questions to ask, here's your time. Seems to be all clear. So we have supporting mechanism, we have funders, funder initiative, we have innovations. Seems like we have a lot of things ready. However, we repeatedly hear this financing gap, right? So the data says by 2030 there's a big gap on climate adaptation financing on health of about 30 billion per year, right? And then 93% of these are not met. So it seems like people are still a bit hesitating in investing. Are they waiting for some key evidence, right? So I would like to maybe for all of our panelists to comment quickly on this. What are the key evidence from your perspective to convince the private and public sector to further invest? Maybe Maddie from your side.
Sure. So luckily, we have a membership network of 600 plus funders. So we took that opportunity to conduct some key informant interviews. And I think what emerged very broadly were three areas that there's limited clarity on. One is, how does climate change impact human health? Like hard data and evidence. What solutions have emerged to address these impacts? And how can social investments really scale solutions? So we heard our community, we heard their needs and this gap, and actually together with the Bayer Foundation and Dahlberg, we launched the Climate and Health Investment Opportunity Primer just last week in Geneva at the World Health Assembly. And what we essentially lay out in this primer is how social investors are indispensable for catalyzing change in underinvested impact areas like climate and health. And this is because of their unique ability to provide funding and market building support without the expectation of market financial returns. So very simply, I invite you all to read the primer, but we've put out a simple call to action in this, where we're urging social investors to invest in evidence building and data generation by deploying philanthropic capital, and investing in solution development and scale by deploying philanthropic capital and impact capital, including blended finance. So from our side, the primer is ready to go, and it provides both direct and indirect pathways, but I would love to talk more about it later.
Celeste?
Yes, so I actually think that, of course, there's always missing evidence, but there is a significant amount of evidence showing the effects of climate change on health. And I do think, or before last week, the World Health Assembly, I would have said, we're lacking political courage, and countries and governments and political actors just really taking a stance to say, we need to address this problem. Last week in Geneva, the member states actually adopted a resolution that recognizes that there are urgent changes that need to be put in place to mitigate the effects of climate change on health. So I think now we also need to hold these governments accountable for what they're saying they're going to do. But yeah, I think one other aspect on evidence and data is the fact that there is evidence, but that it's a lot of it stays in the academic peer-reviewed studies format, and it's maybe not so accessible to private foundations or just other actors that are not so familiar with the format. So we actually publish reports, insight reports, which kind of gathers and takes all the evidence specifically on health and disability. We haven't published a report on climate yet, but maybe yet to come. And just to provide, funders and implementers with that necessary evidence. And just one last thing, I think on data specifically, I know that governments face a huge problem on data collection, and specifically for disabilities, there's no really standardized way, or there's no country that collects data in an effective way that can actually support then policy measures, and when we work with governments to kind of look at their health system, this is one aspect that we often point to say, you need to collect the data to know where the gaps are in your country. So there's, I think, more work to do on that level for data. Yeah.
She has a question.
A question, yeah. Yeah. Sure, yeah. Yeah, almost a great tip because like these responses. I think are so important from a systemic perspective, right? And the way that we always think about our problems is if we look around at the different entrepreneurs in this room and view them as humans that are trying to build organizations. That is hard work, right? You're trying to expand. You're trying to build a team. The challenges that you have are vast. For all of you that are here, there are hundreds and thousands more of you that are not, right? In fact, there's 10 million social enterprises around the world. 9 million are never going to get the financing support, right? And so I think from a very human perspective, we should look at these entrepreneurs also as humans and connect with them as humans and say, like, what do you need, right? You need maybe some coaching this time. You're growing a team. Maybe we need to train your team. And so I think I'll build on that question. I think the challenge is that we build trust with entrepreneurs to say, if you go through the effort of telling us your needs, we will actually give you the support, right? Because so often we hear their needs or we do a survey or we say apply for a thing and then they never hear from us again. And then it's exhausting to go through those motions again. So I think it's to really build trust by giving value. So I think that then maybe leads to my answer to Peng's question here, which is, for those of you that are funders in the room, please also consider if you are getting some of those insights, how can you then follow on with non-financial support, right? How can you make still expertise or knowledge available to anybody that interacts with your organization, even if they're not the ones that are qualifying for funding?
Thank you. Thank you so much, Mark. And thank you, Andrea, for the great question. Taz, maybe you want to also continue?
Yeah, no, absolutely. So as I think, once I hear from, I think clearly I strongly believe and I'm convinced that the climate health is actually causing major health issues across the world already. We have, even I didn't mention the entire cholera that has happened in Malawi after the floods is a real example that's happening now every year, and it's going to have a larger impact. And the geographies like those in the global south are going to be most vulnerable. From a perspective of CCAM, which has been working on science-based innovative solutions for such geographies, I'm convinced, honestly, that I think building solutions locally, which understands those problems, are much more effective, right? And the great combination, it's a great collaboration between global best and local best, in a way, to actually address the public health issue, which are going to happen through the climate. But the issue is that there is no market pull for that. The market pull is missing, and hence that's the risk capital which is required to come in from the philanthropic approaches to ensure that there is the first rigor funding that comes in. And I think the years of work we have put in, and one example I cited, it is hugely possible for us to actually make a huge dent in such catastrophe that is in front of us by building that, trusting that evidence, building this 3 to 5 years of lighthouse that we are, attempting as a pilot, generating evidence out of it, and scaling it up after that is a way to go forward. If we stay outside and on the boundaries for too long, I think we will be too late to actually do it. And I think too much of analysis can lead to paralysis, and that we all know about it. I think we need to take a risk. And yesterday I heard somebody say, as we fly, we build our plane. And that is true. I think we got to act now. And that's evidence is there for us to believe in ourselves and do interventions that is required.
Thank you very much, Taz. And another round of applause for all the panelists. Thank you so much for sharing. Thank you.
Thank you.